once the patient has finished their fixed appliances in their orthodontic journey and move on to their retention phase, we supply them with some plastic retainers. Historically, we would bring them back in for quick reviews to make sure everything's okay. We're trying now to move on to telephone reviews to kind of triage, make sure everything's okay, and then if needed, bring the patient in, which will reduce patient travel and therefore cart emissions, reduce unnecessary instruments that we have out during these procedures and reviews. Sometimes we just have instruments there just in case, so this will reduce that. And that will work to reduce the indirect emissions as well as direct emissions. And also reducing electricity consumption overall in the surgery. So we won't need the chair, we won't need the light. We could go to a smaller office and just use the telephone and computer. So this is the protocol that we put in place, and it's a nice flow chart of the patient's journey from removing their fixed appliances all the way to about a year after debond. So if we follow the column towards the right, that is the best case scenario where a patient doesn't have any issues and will only need telephone triages to make sure everything's okay and track. The column on the left shows that if there were to be any issues, we could then initiate an appointment to bring them in. And hopefully we anticipate that most people will have no issues and won't need to be seen, therefore dramatically decreasing the amount of patients that need to come in for face-to-face reviews. So the way we did it, we would measure the distance between the patient's home address and the orthodontic clinic. And by calculating the distance they travel, we can calculate an estimate of their CO2 emissions. And also the carbon footprint of review clinics. The way we would measure those is by looking at the figures already there for in-person dental examinations, because that's the closest thing to a review appointment we have. So overall, we estimate that we saved patient travel altogether of around 756 miles. So we found the mean miles traveled per patient was just under 19 miles. The distance patients traveled ranged from 1 mile to 141. So for some patients it was saved significant miles, petrol or fuel and time. So this graph shows the carbon footprint of travel to appointments. We have kind of 3 different modes of transports we guessed the patients would be taking. So we saw if they all travelled by train, how much we'd save, and then a car using diesel, petrol. And you can see, particularly for the cars, there was significant amounts of CO2 equivalent reduced. So that was the amount saved. So this chart shows it in CO2 equivalent, so kilogram per CO2 equivalent. And again, it shows the cars, the trains, but also the column on the right shows the surgery time. So almost equivalent to using a car, we saved in carbon footprint just by shutting down the surgery and moving over to telephone reviews. So overall, we felt that nurse-led telephone retainer clinics are an effective way at reducing the carbon footprint within NHS Tayside. There was nothing negative noted. We didn't have any negative feedback from patients, and we didn't note any decline in the service provided to the patients.